Hello, and welcome to this edition of Western Maryland Today. I'm your host, Tyra Mason. On today's show, we will learn about some of the work done by Western Maryland's nonprofit organizations. We'll also be joined by Frostburg State University students, Cassie Conklin and Scott Warren, who will talk about the upcoming 2020 census and why it's important to be counted. We will also talk to HHEC West Executive Director Susan Stewart. HHEC West is a nonprofit organization whose mission is to improve access to and promote quality in healthcare through education and collaboration. But first, we'll be joined by a representative of the Local Management Board of Allegheny County. This organization is highly involved with the welfare of children and families in the area. Please stay with us.
Here you go.
Thank you.
Thank you.
Welcome back. Now joining us is Executive Director of the Local Management Board of Allegheny County, Renee Nisley. Thank you for coming in today.
Thank you for having me.
Renee, could you please explain to us what the Local Management Board does?
Well, we are a neutral convener of child and family agencies throughout the Allegheny County region. Then we identify our local needs and target the resources for our local needs. Our programming, our majority of our funding comes from the Governor's Office for Children, which is under the division of the Governor's Office for Crime Prevention, Youth and Victim Services. That's new because it used to be GOCAP, which is Governor's Office for Crime Control and Prevention. So what we do is we focus our local needs based on the Governor's 4 strategic goals, which are children of incarcerated parents, childhood hunger, disconnected and opportunity youth, and youth homelessness.
What programs does the LMB provide to the county with the funding from the Governor's Office for Children?
We currently are in our 2nd year of funding for a 3-year program, and we have 3 different target areas that we're providing funding for. One is the Home Builders Program, which is through a partnership with Presley Ridge. They provide the service, and that is a service, it's an intensive needs, in-home intensive needs program for children who are at risk of being out-of-home placement, or children of incarcerated or substance abuse parents who are in foster care. We also have the detention center program, which is multifaceted. The first portion of the detention center program, and this is at the Allegheny County Detention Center, it's for incarcerated parents, so it's inside the jail. So our first facet of that program is a parenting program, which we are using the Parenting Inside Out. It's a jail-based, evidence-based program, which is offered through a partnership with Family Junction, and their staff administers that program to anyone in the jail who wants to learn about parenting, how to be a better parent, communication, etc. And that's a 12-week, 2-hour-a-week program. We also have the GED program, which inmates could always study for their GED, they could never test for it. So we've provided computers and access to be able to test for their program, and that's a higher success rate because studying for it and then testing for it is a higher success rate while you're incarcerated. And then the third facet of that program is a vocational skills program, where you're not any hands-on training, however you can get certified in learning about like small engine repair or culinary skills. And it just kind of gives you a little bit of resume building and just some more knowledge of what certifications you would need for a specific topic that you want to be employed by. And that gives the inmates a higher success rate and lower recidivism. And then we also have the local management board is providing a trauma-informed care education series. Last year we did the Trauma Summit, and that was very successful. And what the people who went to that class asked us for is more in-depth training on trauma-informed care. So what we are doing this year is we are offering a trauma-informed education series, which is going to be held at the Allegheny College of Maryland, April 14th and 15th and May 19th and 20th. And if anybody's interested in going, they can always go to our website at AlleghenyLMB.org to find out, and it's free to anyone who wants, anyone in the community. And what this is doing, and this is preparing our community to become a trauma-informed community. So we are going to be next year with our funding, using that funding to convene some local agencies to start changing policies and really doing trauma-informed care in the community.
Wow, that's amazing.
Thank you.
You're welcome. Renee, please tell us about the local care team.
Another facet that the local management board has is the local care team. And we have a local care team coordinator, Caitlin Weems, who could not be with us today. However, what the local care team is it's a body of child and family serving agencies who are more or less a brainstorming session with a family. It's usually for children with more intensive needs. So they ask the local care team for resources, and we convene, and if we feel that it's enough to bring before the team will discuss the situation, the challenges, and what the child needs, and then offer the family a plan of what resources they should look into and what would help that family.
Okay, wow, that sounds like it's really helpful.
It is very helpful. Last year we served about 23 children.
Oh, wow.
Yeah, so it was, and most of those children have not returned or have not gone into out-of-home placement or anything, so it's been very
beautiful.
helpful.
That's good, that's really good. That's good to hear. What other funding and programs does the LMB provide the county?
In addition to the Governor's Office for Children's funding, we also have funding through the Maryland State Department of Education for an in-home visitation program that we partner with the Cumberland YMCA Family Center to provide for pregnant or teen parents to help them to nurture their children and get them ready to learn in school. We also have funding through the Allegheny County Health Department, Cigarette Restitution Fund for a model smoking prevention program in all area middle schools, 8th grade, that we provide that helps children learn what the harmful effects of tobacco use and vaping. Yes. This year we've added the vaping since that's such a big issue, especially with our young people. And then we also have another grant that we just recently acquired through the Governor's Office for Crime Prevention, Youth and Victim Services through the Burn Justice Grant, and that's for a youth center that is going to be opening in downtown Cumberland, and we're in partnership with Allegheny Youth Enrichment Program Services, or otherwise known as APES. They're going to be opening a youth center that's going to have all kinds of programs for children who are at risk of getting involved with juvenile services, or just children who don't really fit into anything that the schools offer. So they're going to have mentoring programs and art classes and tutoring and etc., that kind of stuff. So
wow, I think that's a really amazing thing to have in a small town such as Cumberland. So
and we don't have anything like that, so
exactly.
It's going to be great once it opens.
Wow, I love that. That's really beautiful.
Thank you.
Thank you for joining us today, Renee. When we come back, we'll hear from a representative of AHEC West, an organization charged with improving access to and promoting quality healthcare. And later, we'll be joined by 2 FSU students who will talk about the importance of the 2020 census. Please stay tuned.
You don't know what I'm going through.
Why don't you ever talk to us? What is going on with you?
I don't know, just so down. I just don't care about anything anymore. Depression was hard on me and my family, but it turns out I always had the strength to work my way back. I just needed someone to show me the first step, so I could be me again.
1 in 3 adults has pre-diabetes. That means it could be you, your favorite brother, your other brother, you, your football buddy, your football buddy, you, your plumber,
Breathe right into your foot.
your plumber's masseuse,
Yes.
you, your dog walker, your cat jogger. With early diagnosis, pre-diabetes can be reversed. Take the risk test at doihaveprediabetes.org.
Welcome back. We're now joined by the Executive Director of AHEC West, Susan Stewart. Susan, thank you for joining us.
I'm happy to be here.
Please tell us what AHEC does.
Well, we do a whole lot of different things with what we, in our mission, is to improve access to and promote quality in healthcare through education and collaboration. So we too are a neutral convener, like the local management board from the last segment. Part of how we achieve our mission is providing interprofessional continuing education to health professionals. We do that in all areas of whatever health topics there are. We also specialize in geriatric training for students and also for health professionals. We have a national project with HPV immunizations with the Centers for Disease Control. And we provide all kinds of other continuing education programs. We do this in collaboration with community colleges and hospitals and health departments. So that's kind of one form of education. The other is we facilitate clinical rotations for health profession students like medicine, dentistry, pharmacy, nursing, whichever you can think of it. In fact, we work with Frostburg State at times as well. So students here participate in our programs too. We have a national program called AHEC Scholars. All 261 centers in the country have AHEC Scholars programs, and it's a clinical and didactic program to train health professionals. So there's one side of it, and that's kind of a not so public-facing side of AHEC. But our public-facing side is we are the health insurance navigator program for Washington, Allegheny, and Garrett counties, which helps people get health insurance plans through the Affordable Care Act. We have people are located in Hagerstown, Oakland, and Cumberland. That's our main office is in Cumberland. Then we also have an opioid prevention program for women, and it's funded through the Office on Women's Health, the federal office. That program utilizes yoga and education to help women be connected, and it's been almost 3 years and people love it. So that's been a very important program, I think, in the community. We also have an RCORP grant. That's a Rural Communities Opioid Response Planning Grant. And we're working with all the organizations around this community, Allegheny County specifically, to plan for recovery services, prevention services and programs, and treatment programs, and trying to bring more money into this region to attack that issue, which is a beast, as we know. We have community health workers. They help people with access to health care, helping their social needs get met. They may need transportation funds. They may need all kinds of things, and the community health workers help them. So they connect them to care. The other thing we do on public-facing education is we provide the National Diabetes Prevention Program for the public. We also do chronic pain self-management programs and chronic disease self-management programs. So it kind of goes on and on. One more public-facing thing that we do for people of low income, this is regional as well. Wherever we have the money, as much money as we have, we spread it around. For low-income individuals, if they need access to dental care or dentures or partials, we obtain grant funds to do that. So they have to be low income. And we work with dental providers and dental clinics to get them reduced care. We pay for it. It's free care because it's people who really can't, just cannot afford dental care. And we are highly involved in the Mission of Mercy Free Dental Clinic that occurs about every 2 years. So ask me next week and we'll have another program doing more things.
Amazing. All those programs, definitely needed.
Thank you.
Now, what opportunities does your organization provide for people in Western Maryland?
Okay, if you're a high school student, we have an Exploring Careers and Health Occupations program. And it's housed here at the Frostburg State Campus every summer. And we get them to WVU, University of Maryland, School of Medicine, Shock Trauma, all over the place, and they get hands-on experiences in exploring these careers. I know this year we've added the Frostburg State Physician Assistant Program. It's in Hagerstown, operated in Hagerstown, and they have a wonderful setup, and they're going to take the students through some hands-on activities there with all the equipment they have. Wow. And so that's high school. I already mentioned the STEP program, which is Stretching to Empower. That's the yoga, and the dental care. Those are the basic opportunities, or if you want other education courses for diabetes, other chronic disease management programs.
Okay, a lot of variety. How can people learn more about the services you offer?
Well, I think the best thing is ahecwest.org. And of course, if it's health insurance, there may be students here who need health insurance. And that is ahecwest.org, or it's 888-202-0212. And if someone needs an appointment, they can just schedule it online through our website.
Simple as that. Well, Susan, thank you so much for taking the time to talk to us today. After the break, we'll be joined by 2 FSU students who will talk about the importance and benefits of participating in the 2020 census. Please stay tuned.
If you had something that you were given, something you loved, something that others wanted so badly but were denied it, something that you used and relied on every single day. If you had something special, something beautiful, something powerful, if you had something absolutely essential to securing your health, happiness, and safety, if you treasured something so much that you were willing to die for that something, if you knew that others already had, and if someone had given you a document that protected that something, wouldn't you take the time to read it?
Welcome back to the show. We're now joined by 2 Frostburg State University students, Cassie Conklin and Scott Warren. They're involved with the 2020 census. As you know, the U.S. Constitution mandates that every 10 years, every person living in the country is counted. This is a tall order, but one that has benefits to us. Cassie and Scott, could you please tell us how you're involved with the 2020 census? Please.
So we both work under the Director for Civic Engagement at the school, so Patrick O'Brien. I believe he got a grant for us, right? So,
that's right.
Yeah. So he got a grant for us, and we've both been connected to him through multiple different ways prior. I go to like his time stock events and everything like that, and his town halls, the Democratic debates as well at the Lane Center. And so that's how I got connected with Patrick.
Yeah, and so I'm a geographer, and the U.S. Census is really important to the data analysis that we do, and so this connected directly to my learning experience and to my discipline. Plus I have been involved in civic engagement with Patrick O'Brien before, so it was a seamless fit.
Okay. Mm-hmm. Now, what activities are you guys involved with at the university that are connected with the Complete Count of the Complete Count Committee?
So this coming tomorrow, we actually have a meeting. I think it's at 6 p.m.
Mm-hmm.
So 6 p.m. tomorrow, it's in lane probably 109, right?
That's right.
And so we both run those meetings. She normally creates the agenda for that. But yeah, we just talk with a few other people that are actually representatives from the census. They come I think one's Ashley and one's Chris, correct?
That's right.
Yeah, and so they've been very helpful in getting us connected and having us have all the information that we need to educate everyone that's at the school, both that are living on campus and off of campus. We're also doing things like tabling. We're tabling today as well from 12 to 2. And we're going to be trying to work with the Complete Count Committee to create a plan to try to reach out to as many students as possible to both educate them and also get them informed and try to count themselves in their houses.
Yeah, so part of that education, really good answer, part of that education is that, again, this is US constitutionally mandated, this 10-year count, and it's really important for a lot of reasons. And students don't necessarily know those reasons, but those include funding for roads and schools and ambulances. It's also the data by which companies like Chipotle or Target choose where they're going to place new locations, because if there's a population there that supports it, you know, it's beneficial for them to be there. And so we've been spending a lot of time with the Complete Count Committee trying to get that message out to students. Also, students are confused about whether they should be counted in Frostburg. But the US Census Bureau is really clear on this. They say that wherever you're laying your head on April 1st, 2020 is where you should be counted. And so that includes if you're in the hospital, technically the hospital will count you there on April 1st. That includes rehab centers or prisons too. So wherever you are on April 1st is where you should be counted. And I know that may be confusing for students, but that's part of what the Complete Count Committee is trying to do, is to get that information out.
Yeah, that's a question that I was wondering too, like, how am I counted if I technically don't live here in this area?
Yeah, I think that's something that everyone's a little confused about. And those that live on campus won't actually have to do anything. The Office of Residence Life will count them as part of group housing. So that's definitely important to know. And really, so we're targeting off-campus students who will be receiving mailers, postcards in the mail with how to do it. And for the first time ever, students, and actually the entire population, can conduct the census online. And so that's new in 2020 and really exciting. It's going to make it a lot easier for folks to get counted. And moreover, the process only takes about 10 minutes. So students just need to know that they should be counted here. The process takes 10 minutes. They can do it on their phone. It's really very simple. And I definitely think that's how we're trying to get them to get counted.
Yeah, kind of going back to with the residence halls, that also includes Edgewood. There's probably some confusion on that just because Edgewood is its own apartment complex, and but it does include Edgewood. So any residence halls, including Edgewood, is going to be automatically counted. So none of the students there have to actually worry. So that's part of like the education that we're going to be going for, is explaining to students that they don't have to worry about it, or they have to think about it and do the census. But I believe it's only 9 questions, right?
That's right.
It's just 9 questions that you have to fill out. And like she said, it takes about 10 minutes. And we're going to be trying to work on some incentives to get people to do it, especially in lane with us. So, yeah.
We love incentives.
Yeah, so, right, and so some of the activities that'll be starting, again, we've been tabling, so you'll see as we have so much swag. We've got like pop sockets and hats and I know, those are expensive. So we've got all kinds of swag to give away, but our big event is actually going to be on April 1st. So Wednesday, April 1st, 2020, which is Census Day, we're going to be planning events in the Lane Center, so you'll see plenty of people and further incentives. And I also want students to know that if they misplace that postcard, that they need not fret, that you can actually look up your address and fill out the census without that postcard. So if students are on April 1st thinking like, oh no, how do I get counted? We're going to be at the Lane Center. We're happy to help people walk through the process. And again, they don't need that postcard. It's just a reminder, a physical reminder to get it done.
I want to again thank Cassie and Scott for joining us. I also want to thank Renee and Susan for joining us too. And thank you for watching. We hope you have found today's information to be useful. Please stay tuned for more FSU TV3 programming.